Welcome to Connecticut GI's Video Shorts. My name is Joe Gregoire, and I'm joined today by Dr. Neil Parikh, a gastroenterologist and chairman of Connecticut GI's Education Committee. Today, Dr. Parikh will provide a brief overview of patient options for colon cancer screening. Welcome, Dr. Parikh.
Thank you, Joe, for having me here today.
Dr. Parikh, what options does a patient have when it comes to screening for colon cancer?
Well, there are multiple options, broadly into three categories. There are stool tests, radiographic tests, and endoscopic tests. When you think of stool tests, you think of tests that look for blood or tests that look for stool DNA or cancer DNA. When you think of radiographic tests, there is the CT colonography, previously known as the virtual colonoscopy. And when you look at endoscopic tests, we have the sigmoidoscopy and then the full colonoscopy.
Okay. Now, I know that we talk about colonoscopy as the gold standard test. Can you tell us a little bit more about colonoscopy and why it's considered that?
Of course. I will preface by saying that the best test is actually the test that the patient is comfortable completing, because any colon cancer screening is better than no colon cancer screening. That being said, the colonoscopy is considered the gold standard for a multitude of reasons. First, it has the greatest or highest ability to actually detect polyps and cancer. Secondly, it has the lowest false positive rate. So if you do have a positive screening test, it's likely not to be a false one. And thirdly, it's truly the only preventive test, and I think that's a really key point. Whereas when you get a colonoscopy done, you're not only finding colon cancer, you're preventing future colon cancer, because you can find the small polyps that you can easily take out and remove.
Thank you, Dr. Parikh.
Thank you.